Il y a 6 ans depuis que j'ai déménagé ici, chez nous, de Saint-Jean et de toutes les villes que j'ai restées. Puis, je suis fière que je suis venue parce que j'avais cause d'aider les âgés avec les médecins et toute leur santé par les apporter, les voir, les médecins, puis les infirmières, puis être là pour les parler. En tout cas, qu'il y avait quelque chose qu'ils ne comprenaient pas, parce que c'est tout en anglais. Il n'y a pas de service en français. Ça fait qu'il y a comme une demi-douzaine, une douzaine peut-être, de monde âgé ici à la Grande-Terre que j'aide comme ça. Je les apporte à Corner Brook, je les apporte à l'hôpital à Stephenville, puis aussi au docteur, aux cliniques à Lourdes, pour les aider, comme mon père et des voisins. Puis, moi, ce qui m'inquiète maintenant, c'est que je compte déménager encore à Saint-Jean-de-la-Ville. Parce que j'arrange moi-même et je peux être avec les services, les meilleurs services en tout cas. Ça fait que je vais quitter, puis ça m'inquiète qu'il n'y aura personne, je ne sais pas qui pourra le faire, mais il n'y aura personne pour les aider. Puis, s'il y aura des services en français, ça sera meilleur pour tout le monde.
Et c'est important pour ces personnes âgées-là de parler français?
Oui, parce que c'est pas tout qui comprennent en anglais. D'accord. Il y a beaucoup qui comprennent, pour la plupart, ils comprennent, mais quand même, pas. Puis quand ça vient à ta santé, des fois, il y a comme une vieille personne, il y a comme, peut-être qu'il y a 3 affaires, 3 éléments, je sais pas. Puis il faut pas oublier toutes les affaires qu'on demande. Puis s'ils ont un nom de français avec eux, ça le fait, c'est meilleur. C'est ça le service que je voudrais voir. Okay. Si pas de médecin ou si pas d'infirmier, quelqu'un pour aller avec eux.
Since I've started learning French, I've come to realize how important being able to speak French is to our Francophone community. We have many patients who don't speak any English or very little English, who come from St. Pierre-Miquelon, even from here in Newfoundland-Labrador, as well as other nationalities whose second language is French. The patients that I've been able to care for who speak French have been really appreciative of my efforts to speak French to them, have been very grateful that I'm learning French, and have been very supportive and helpful to me, as well as myself being able to offer services to them in French. Being able to ask them questions, explain procedures, has been very helpful and has made their hospital stay a much better experience. As well, this past year we had an obstetrical patient whose second language was French. She spoke very little English, and when we realized she could speak French, I was able to help her nurse explain baby care to her and her husband in French, in a language they could both understand. So it was very helpful and it was very much appreciated.
In public health, we encounter a lot of people. There's a lot of people moving into Newfoundland who, for work, who are French-speaking. And I think it is an asset to be able to speak with those folks, especially given that here in Canada we have 2 official languages. I've used my French to communicate with families. I've called moms who don't speak much English at all to make first contact with them to discuss their child's immunizations records. And I've used my French to speak to students who have some English, but are able to help me translate their French vaccination record as well.
suis francophone, mais je parle bien l'anglais, donc je suis capable de me débrouiller quand je vais chez le médecin. Par contre, je connais pas vraiment les mots spécifiques à la santé en anglais. Donc, chaque fois que je vais chez le médecin, je dois faire ma petite recherche avant sur Internet pour trouver les mots spécifiques pour pouvoir m'exprimer chez le médecin. Puis des fois, on a des problèmes de compréhension quand le médecin me pose des questions puis que je dois répondre à des questions que je connais pas vraiment, mais on finit toujours par se comprendre quand même. C'est sûr que ça prend un petit peu plus de temps, puis c'est ça.
I think that it's very important for the nurse and the patient to both speak the same language. It increases the trust between the nurse and the patient, and it also decreases the risk and helps the patient's length of stay to be decreased. Recently I took care of a woman who came here from Quebec, and she had to have an emergency surgery and ended up having an ostomy, and I had helped her change her appliance in French, and she felt confident when she was leaving and going home that she was able to do it, and she was so thankful, and it was so gratifying to be able to help her, and she went home and she's doing well.
I'm trying to learn French now. I'm working in the community, and I feel after seeing many families in the stressful situations they go through, the relationship they have with their healthcare provider is really important. It's one of trust and it's one of intimacy. So if we can try to speak the language for them, not only does it help us to establish histories and know what's actually happening, it really gives a good basis of therapeutic relationship between families. And I think that's as important when it comes to caring sometimes as the actual tasks that we do, definitely. We have a lot of immigrants that have come to our community, and sometimes being able to show them that you're trying to meet them halfway is really important in making them feel welcomed and empowered in the community as well. So I feel that that's important, especially when you're working with young families who are dealing with new problems and the stresses of worrying about their children.
I've found that taking French has been really, really helpful for us. We're a very small department, there's only a couple of employees, and nobody here had any previous French experience. And in addition to the St. John's and Avalon population, we also serve everybody in the entire province, Newfoundland and Labrador, and we also service St. Pierre as well. So between the Francophone population of Newfoundland and Labrador as well as St. Pierre, we do end up with a decent number of French clients or patients. In addition to that, I also spend a lot of time moving around the hospital and have bumped into many French speaking visitors at the hospital on occasion who have been looking for directions to a certain floor or to the stairs or to the bathroom or to the cafeteria, and I've been able to help them out with that. So it's really helped me not only in my own department and my own job, but also just moving around the hospital and helping out patients that need it. So that's why I take French. I've found to be very, very beneficial, and I encourage everybody in healthcare, anybody that could possibly deal with French-speaking people, to at least know the basics. At least know how to make somebody who speaks French primarily comfortable in their own language, and then you can build that rapport and help them through potentially a very complicated or stressful process in their lives.